Top 5 tips to control psoriasis.
It's Psoriasis Awareness Month, and in this video, I'm going to be giving you 5 tips to get control over your psoriasis. Before I do that, give this video a thumbs up if you like skincare content from a board-certified dermatologist. Subscribe and make sure you turn your bell notifications on. That way, you know as soon as my videos go live. Follow me over on YouTube because I'm very consistent with skincare content. Psoriasis. It is a condition that affects about 125 million people worldwide. That's roughly 2 to 3% of the population. If you know somebody with psoriasis or you've heard of it, probably what comes to mind is, oh yeah, a skin problem. People have skin lesions that are flaky, scaly plaques, and they also can have flakiness in their scalp and nail findings. But what people fail to understand is that psoriasis is actually an inflammatory condition that can impact a variety of other bodily systems. About 30% of people with psoriasis have a type of arthritis that can be very debilitating. It's called psoriatic arthritis. There are a whole host of other problems that people with psoriasis face. The base, they are more likely to suffer from addiction, especially to tobacco and alcohol. The base, because of the high levels of inflammation throughout the body, people with psoriasis are more likely to suffer from heart disease, strokes, unhealthy cholesterol levels, fatty liver disease, kidney disease, and eye problems. They're also a lot more likely to suffer from underlying mood disorders such as depression or anxiety. The people with psoriasis often struggle to maintain a healthy weight, and many are overweight or obese. They can have high blood pressure and diabetes. There is a strong association between psoriasis and inflammatory bowel disease, especially Crohn's disease. A lot of people with psoriasis end up having Crohn's disease as well. Now, the tips I'm going to be giving you in this video are going to help a lot if you implement them, but I want to make it crystal clear. Psoriasis is a chronic, inflammatory condition. There is no cure for it. It goes through periods of remission, where you may have no skin lesions and feel great, but it can and often does come back. It requires ongoing treatment and management. It's not something that just burns out and goes away. So keep that in mind. There's no quick fix.
Tip number 1. Stop smoking for psoriasis.
You have to quit smoking. A lot of people with psoriasis struggle with addiction to tobacco smoking, and this is one of the worst things you can do. It sabotages your control over psoriasis and also the efficacy of medications. When you smoke, you're basically pumping in more inflammation, which is already pretty high in psoriasis. That contributes to skin findings and later on, joint problems. If you can quit smoking, it will reduce your risk of associated heart disease, high blood pressure, and stroke. Lower your risk of gum disease. Result in fewer flares of skin lesions. Increase the length of remission. One subtype of psoriasis, palmoplantar pustulosis, is particularly stubborn and debilitating, especially when associated with psoriatic arthritis. It is very difficult to treat if you smoke. Quitting is not easy. Many people try and fail. That's okay. That's perfectly normal. Don't beat yourself up. You have to keep trying again and again. Talk to your doctor or dermatologist. See what treatments or counseling options they can offer. There are many tools and support systems available to help people stop smoking. I encourage everyone, psoriasis or not, to quit smoking. It's one of the worst things you can do for your health and your wallet. Cigarettes are expensive. Tip number 2. Limit alcohol for psoriasis. Limit your alcohol consumption. People with psoriasis are at increased risk for struggling with alcoholism. We don't fully understand why. Those who consume alcohol in excess tend to have more stubborn, treatment-resistant psoriasis. What counts as excessive? For men, more than 2 alcoholic beverages a day. For women, more than 1 alcoholic beverage a day. Excessive alcohol leads to fewer remissions, makes treatments less effective. leads psoriatic arthritis, raises the risk of fatty liver disease, can worsen liver side effects from medications like methotrexate. Alcohol is also a depressant. If you're struggling with depression, which is common in psoriasis, alcohol can make things worse. Moderate alcohol from time to time isn't forbidden, but if you feel alcohol is becoming a problem, please seek help. Tip number 3. Maintain a healthy weight. Many people with psoriasis struggle to maintain their weight. Being overweight or obese increases the risk of diabetes, high blood pressure, liver disease, heart attack, more severe psoriatic arthritis. Research supports weight loss for overweight, obese people with psoriasis. It can exceed the number of psoriasis flares, produce better remission times, make it harder for psoriatic arthritis to progress. You need to keep a healthy weight to maintain psoriatic arthritis. Here are some tips. Avoid crash diets and random internet advice. Talk to your doctor. They may refer you to a dietitian or offer counseling if necessary. Tip number 4. Follow a healthy diet. Eating a healthy, balanced diet is key. Avoid chasing after crash or fad diets. Make sure you're eating a variety of nutritious, anti-inflammatory foods, especially fruits and vegetables. There's no definitive psoriasis diet, but a healthy eating pattern can help reduce flare-ups, support healthy weight, lower your risk for cardiovascular disease, diabetes, and more. Consult your doctor or a registered dietitian. Don't rely on anecdotal advice online. Tip number 5. Exercise regularly. Incorporate exercise into your life in any way that's manageable for you. Exercise can help with stress, depression, and anxiety, lower inflammation, improve remission and treatment response, aid in weight management, deepen sleep which affects stress and skin. Even simple activities like walking are beneficial. Note, if you have joint pain, especially due to psoriatic arthritis, talk to your doctor before starting new exercises. The joints involved vary. It's not just the hands. Back and hip pain are also common in psoriatic arthritis. Final thoughts. As I said at the beginning, there's no cure for psoriasis. It's something you live with. That's why it's crucial to stay consistent with your dermatologist and healthcare team. Get screened for related conditions like heart disease and diabetes. Work with rheumatologists for joint care, especially in psoriatic arthritis. In some areas, clinics have dermatologists and rheumatologists working together to offer comprehensive care. Regular follow-ups. Help control skin lesions. Improve quality of life, which 60% of psoriasis patients say is negatively affected. Enable timely screening and treatment adjustments. I hope these 5 tips helped you out. Living with a chronic condition like psoriasis can feel isolating, but these are 5 areas where you do have control over your skin and your internal health. If you found this helpful, give it a thumbs up, share it with your friends, and as always, don't forget sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.